Okay, here we are, and we're talking about subscapularis. Now, there are many techniques for subscapularis. Number one that I was taught was have the person supine on the table, you abduct their arm, and you go with a knife hand into their axilla. Well, you can do that if you want to, but it's not very friendly. You might never have your patient come back again unless you really accomplished your goal and they feel so much better that they get over the insult. And so I used to do that, and I still do occasionally if that's the only way I can get it done. But remember, there's other ways to work on the body. If you have learned any muscle energy technique or techniques called contract relax, some texts will call it Pnf stretching. Pnf is for proprioceptive neuromuscular facilitation stretching. What that is that you contract the muscle first, and during the period of post-isometric relaxation, you actually take advantage of it. It will not have a protective spasm, and you're sometimes able to pull out the restriction and to release the actin and myosin, which have been bonded together that made that contraction knot. So here's the way you do a subscapularis. Remember, with the arm close to the body, with pec major actually collapsed, it is disadvantaged in that position. As you take the body away, or the arm away from the body, then pec major is more involved because it has leverage, and then you are extending subscapularis, which disadvantages it. So you put that arm close to the body, just push it in, hold the elbow, and then you laterally rotate to see how much length there is in subscapularis. Now, does this hurt you at all here, Bill?
It's
starting to hurt, and you see he's about 45 degrees where his arm actually should be down at the level of the table. So this should come to 90 degrees from the body, and he's stuck about 45 degrees. So let's see if doing this kind of a Pnf stretch where you engage the muscle first and you fatigue it. Now, I hope that I read to you from the paperwork already the technique that I'm going to do here, where you have about a 30% of maximum contraction. You hold it for between 3 and 10 seconds. The first time I do it, I like to go for the full 10 because I want to fatigue it enough that I can take advantage of it during that post-isometric period. Now, how long that is, I don't know. I've done plenty of reading, plenty of studying. I can't find anything that says whether it's a split second, if it's half a second, a full second, I don't know. But know that there is a period right after a muscle contracts where you can stretch it and take advantage of it. So here are the words that you can use. I notice that I am not holding his wrist, but my hand is upon it. Bill, I want for you to push into my wrist for me and hold that pressure. Now, this is not a strength contest. You're trying to fatigue a muscle. And so have them hold it. And so we're probably around 7, 8, 9, 10, and relax for me. Just let it drop, let it drop, let it drop, let it drop. Now from where we are here, would you push into my hand again? Push and hold. And relax for me. Let it drop. Let it drop. One more time. Push and hold. Now as the muscle lengthens, it also weakens it. Remember, actin and myosin lose overlap contact at full length. And let it drop again. Okay, look where we are now. And so if I turn this loose, remember where he was before at about 45 degrees. Now, we're not absolutely back to 90, but we probably got him out of the difficult range because not all of us have a body that has full range of motion, but it doesn't mean we hurt neither. There's a certain tolerance that we have. You can give up a little bit and still not be hurting, but there's a point where your body says, okay, you know, we've had enough of this. We're short enough that's causing compression in the joint, and we need some help. Now, you can put the person supine on the table, get them all the way to the edge of the table so that their arm is hanging down, and you can come up underneath the scapula and contact the muscle. I have done that on plenty of people. It's hard to show on a video, so we're not going to go there. Hopefully you'll join me in a live class one day and I'll be able to show you that technique. But try doing this type of thing for a muscle which most books say that you cannot palpate. Actually, in a lot of people that you can, but when you have a person of size, and let's face it, Americans are of size, aren't we? And a lot of people, you cannot get your fingers into their armpit without a great deal of discomfort. And a lot of times all you're getting is a big handful of lat dorsi and teres major, and you're actually not ever getting to subscapularis anyway. So try doing this. We're going to do it one more time after I'm talking and it has relaxed a little bit. I want for you to push into my hand again and hold. Good. Just hold solid. And relax for me. Okay, now a lot of times when people have subscapularis problems, they're actually unable to raise their arm completely, and after you have done this kind of thing and release some of it, then have them raise their arm up over their head to see how far does this go. Okay, we've got his arm pretty close to down flat on the table. That's pretty good. How much more length do you need in the muscle? And then you actually can hold right on the elbow. We're going to back it off from full length a little bit. I'm right on his elbow. I want for you to push into me a little bit more. Now, this is a muscle with convergent fibers. They have a wide origin and a narrow insertion. And this is actually dealing with the vertical fibers at the lateral edge of the muscle. Up at the top of the muscle, the anterior fibers, or no, the superior fibers are actually horizontal. And so we've fatigued the muscle. Now let the arm drop. Let it drop. Let it go. Okay. So the arm, is it actually feeling pretty decently loose?
Yeah,
okay.
Very much so.
So that's how you do a contract relax. Look up this kind of thing on YouTube or in any class that teaches this kind of thing. There are many roads to Pittsburgh, and how you get there is up to you. Doesn't matter to me. As long as you understand what the problem is, now you can choose the tool to get there. The thing about massage therapy is most people are in this profession for 6, 7, 8, 10 years. I don't know if you even understand what you're doing in 6, 7, or 8, or 10 years. It took me a long time to put together enough of this to where I could use neuromuscular techniques, orthobiotomy techniques, use a stretching technique, a Pnf stretching, to use a contract relax. There's a lot of ways to get there. So when the person is really upsized and you can't palpate the muscle, what are you going to do? How are you going to get there? Find another way. If you can't palpate it and get your fingers on it, find another way to get there. So that's part of the fun of being a therapist instead of a practitioner. So I hope this has helped you some today. Let's get back to the rest of the class.